Moose Pharmacy, or A.W. Moose Drug Company, actually started in 1882, and that was my great-grandfather.
We've grown from our couple original locations, or one, this our flagship location. We call this our world headquarters in Mount Pleasant, North Carolina. There's 7 locations, and they're all in areas that have a particular need that we felt that we could meet.
The family philosophy has always been you take care of the patient first. And if you do what's right for the patient, from a business perspective, that's always going to come back to you.
What you do inside this pharmacy and behind the scenes is very different than just filling prescriptions. So it truly is whatever it takes to give that person better health in that community.
We've gone from more of that just a dispenser that was behind the counter that nobody ever really talked to someone who's actively involved in their health.
When we opened up the Moose Pharmacy Monroe location, which was our most recent opening in 2020, we wanted it to be a place where if you just came from the hospital or you just had a transition of care and you walked into the pharmacy, it felt like a home for you. But along that way, also there are other needs that pop up that may not be able to be met quickly or efficiently or easily in a community where there is not a lot of medical team support. And so instead of going to the hospital to wait for 8 hours to be seen in the ER, could you be seen, even come to the community pharmacy for some of those supports? And so that's what led to the decision of having a physician assistant available in the pharmacy to be able to help with some primary care needs, particularly in a setting of physician shortages.
It's really important to be able to have that shared patient interaction because we get to see them on the primary care side and really help make interventions and changes and things like that. But then on the pharmacy side, being able to make sure they're getting their medicine. A lot of those patients we deliver to, so they're homebound patients who really need that extra care. So being able to see them in the clinic and help them that way, but also see them on this side of things and making sure that they're getting those medications as needed really just helped with that continuity of care and helps control those patients' disease states as well.
To be able to do the things that we tell all these folks we can do, we need to have that open communication between all the providers. There's obviously still room for improvement, and not only just with providers, but with payers and everybody else. So there's a way to openly move that information back and forth so we can help that person in an efficient manner, and we're not constantly trying to chase somebody to get those actions taken.
Electronic health records is a time saver as well as much better care. So we leave that open and are working from their electronic health record the whole time we're filling prescriptions and working with that patient.
Being able just to react to those data points and to be a health hub to disseminate that information. What will be great in the future is more improved bidirectional communication where we'll be able to message the care team or in some format be able to get meaningful data into the provider or care team's hands to get a reaction much quicker instead of spending time on the phone or doing it in an old-fashioned fax communication strategy. We look forward to any ways that we can participate in seeing advanced technology to communicate, whether it's with the patient or with that care team.
A lot of those things too you want to happen right away. You don't want to wait 2 weeks till that message finally gets there. But still too, as payer opportunities come in, there needs to be ways to get that information to those payers because they are starting to realize, wow, these guys do help us save money. They do help us improve outcomes. So, but we need to be able to integrate all that. And I know that's easier said than done, but that really needs to be the goal.
What we're really looking for in technology are ways to reduce the administrative burden that is cost effective to try to drive down the cost of that administrative part of things so we can actually workflow in the care process, the having the one-on-one conversation, the going back and looking at the physician's electronic health record to try to do a deep dive to find out what is the care plan. To do those activities to reinforce the care plan and get everybody on the same page. So the physician, the pharmacist, the physical therapist, the wound care nurse that's coming in home, we're all operating with the same care plan. We're not kind of all operating out of our own silos.
You know, I think the patients need to know that there are things that we're doing that are improving the way this communication happens, which improves our outcomes.
I think the ability that they have to embrace the change has definitely contributed to the ongoing success of the business over the years. And I suspect Joe's grandpa and great-grandpa probably had that same principle, and that you don't get overexcited about things. You just form a plan, you embrace the plan, and you make the change. And that's what I've seen from their leadership.
I challenge my fellow clinicians, partners, pharmacies, physicians, health systems, everybody out there to foster these meaningful collaborations and embrace them for a better outcome for everybody.